So your learning outcome is to list and discuss the factors that influence stroke volume during exercise. So quick review, if you remember, cardiac output is the amount of blood that the heart can beat in 1 minute, and that's a combination of beats and stroke volume. So beats is actually how many times the heart contracts, and stroke volume is how much the blood is pumped out in millimeters each time the heart beats out of the left ventricle. So at the onset of exercise, the cardiac output will drive up rapidly, and then as you reach a steady state, it will have like a gradual increase and then eventually plateau when the blood flow is meeting the metabolic demands. So what influences stroke volume during this process to reach these metabolic demands? So what we'll get is we'll get increased ventricular filling, okay, so preload during the diastolic phase. So that's the phase when the heart is in that relaxation filling phase. And what will happen, you'll get more blood into the left ventricle, and that'll allow it to expand more, or you get more stretch. So we've got that preload, and that'll allow for more contraction. So you've got that elastic component that comes into it. You've also got, so each time the ventricle contracts, we'll have an increased amount of the percentage of blood pumped out of the left ventricles. So during at rest, there will usually be about 40% of the blood that left in out of the total volume. So more of that is ejected whilst in exercise. And that's due to things like catecholamines increasing the myocardial contraction. As exercise continues, you'll start having factors that influence stroke volume the other way, so it'll actually decrease. This is, 15 minutes onwards, we start getting things like sweating, reducing the blood volume. We've got our blood moving to the periphery, so it's going to the limbs to reduce our heat, so the heat's been transferred to the environment. So we're actually, during that phase of diastole, when the blood's supposed to come from the venous return and fill, we're getting less in it. So to get the same cardiac output, we have to increase our heart rate. And if you're already at maximum heart rate, then there's going to be no increase in cardiac output, and then we'll have a decrease in performance. Another interesting fact, prolonged endurance training will improve the amount of volume that can fit in the left ventricle. There'll be a decrease in cardiac and atrial stiffness, so that's more pliable to allow more blood to pump out because there's less afterload. You may also get, as you get fitter, brachycardia, so your heart rate will slow down. That will allow more time for the left ventricle to fill, and you may get an improvement in the actual intrinsic factors causing the myocardial contraction.